Welcome back to Conversations with Great Minds with Dr. Mitchell L. Gaynor. Dr. Gaynor is founder and president of Gaynor Integrative Oncology and clinical assistant professor of medicine at Weill Medical College, affiliated with Cornell University and New York Hospital. Dr. Gaynor is board certified in medical oncology, hematology, and internal medicine, and is the author of 4 best-selling books, including Nurture, Nature, Nurture Health, Your Health, and the Environment. So let's get back to this. Dr. Gaynor, you were talking about some options that people should consider and pursue. Do you want to continue that train of thought for a moment?
Sure. The important things about sugar, you have to realize not all sugar is bad. So it's mainly the ones that require a lot of insulin to metabolize. So I tell my patients, you can have all the fruit you want. That's a different kind of sugar. You can have honey. You can have things like stevia or agave nectar. There's a great sugar substitute called coconut crystals that comes from coconut that has a lower glycemic index. Also the same thing with white flour. Go with more whole grains. So sprouted whole grain breads are good. Instead of white flour pasta, go with semolina or buckwheat or brown rice pasta. There's a lot of simple food choices you can make. And there's a drug actually called metformin. Metformin was first developed in 1955 in Europe. It originally came from an herb. It came from the French lilac. It had been used in European folk medicine for hundreds of years to treat diabetes. Now, they noticed over the ensuing decades that people that were on metformin had 40% less cancer overall than the general population. For pancreatic cancer, it went up to 62% reduction. And then a very surprising finding was published about 3 years ago in a major oncology journal. The doctors were looking at diabetic patients with very large breast cancers that needed to have chemotherapy first before they could even consider surgery. So in that setting, we give chemotherapy. Now, some of the diabetic women were on insulin, some were on metformin, and some were on some of the newer anti-diabetic drugs. What they found, quite surprisingly, was that the women on metformin had an almost 3-fold increased pathologic complete remission rate compared with all the other women. That means when they did the surgery and they looked under the microscope, there wasn't even microscopic cancer there. So then a lot of interest was generated in metformin, and it's found to inhibit mTOR. It's found to make your insulin-like growth factor go down by making insulin sugar metabolism more efficient. And it is very, very associated not only with prevention, but also in people that already have cancer. It's even been found that smokers that were taking metformin had smaller lung cancer and less spread to the lymph nodes than other smokers. So again, you know, a lot of these things, you talk about low-dose aspirin, that's pennies a day. Metformin, for certain people, they can talk to their doctor about it because it's a prescription drug. Metformin, we're talking pennies a day. Green tea, including things like garlic in your diet. And then one very overlooked thing when we're talking about cancer prevention is coconuts. Now, in Thailand, that's the largest per capita coconut consuming country in the world. They have the #1 lowest breast cancer incidence in the world. What does coconut have? Coconut's loaded with something called lauric acid. Lauric acid is found in 2 places in nature, mother's milk and coconut milk. So I'll put a lot of my patients on coconut milk powder. It tastes great. It's not expensive. You can mix it in with a shake. Then there are foods like black raspberry. So black raspberries aren't always in season. You can get black raspberry powder for the shake. Black raspberries are loaded with cancer-fighting nutrients. Again, there are so many simple things that people can do to really take charge of their health. And we know that for every 10% above your ideal body weight you are, your risk of cancer goes up a lot. And we have an epidemic of type 2 diabetes in this country, an epidemic of obesity in this country. And that's one of the reasons that we're approaching almost 1 in 2 Americans getting cancer. It's currently 1 in 3. It's approaching 1 in 2. If that's not an epidemic, I don't know what is. And part of it has to do with our diet. Part of it has to do with environmental pollution. There are a number of things, though, preventatively that we can do, because there are really 2 major fields that most people haven't heard of. One is called nutritional genomics. That's about how all the nutrients you're putting in your body affect gene expression. And there's something called toxicogenomics, which is how all the different environmental toxins adversely affect gene expression. So you really have these 2 competing processes going on, and with a little bit of knowledge, you can shift the balance against cancer.
Interesting. I'm curious your thoughts on the debate, and it's presented as a resolved debate, but I remember a decade or 2 ago it was a big debate about whether biopsies could spread cancer, and the whole theory that cancer is not just one cell run amok, but it's a cell that creates its own ecosystem, and that the whole body's involved. You know, what should somebody do if they're looking at options like that? And also, are these supplements the kinds of things that somebody could use while they're on chemotherapy?
Well, again, that is, you know, a whole field, really, because when somebody's on chemotherapy, for instance, you still have an immune system that you have to keep strong. I have all these patients come in completely confused because they say, you know, Dr. Gaynor, I can't find anything to eat because my doctor told me no antioxidants. And if you look at what no antioxidant means, a carrot has hundreds of antioxidants. A tomato has hundreds. A cup of tea has dozens. Anything that comes out of the ground, a fruit, a vegetable, loaded with dozens or hundreds of antioxidants. So literally, if you were to avoid all antioxidants, I think you could probably have distilled water and maybe some pepperoni. I can't think of much else that doesn't have antioxidants in it. So no wonder people are confused. And if you really look at what the goals, and I use chemotherapy, I use monoclonal antibodies, we do bone marrow transplantation. You know, all these kinds of things with allopathic medicine are necessary if you have cancer, but they're not sufficient. So by themselves, it's not enough. You have to make the individual stronger. You have to support the body systems, mainly the immune system. And I was just at the national cancer meetings this past weekend in Chicago. There's all these new therapies now geared toward boosting a person's immune system, toward not harming normal cells so much. So literally, we're moving that way in oncology, but I think the missing link is what each patient can do for themselves to stay cancer-free longer. You have to remember, everybody's going to have some dormant cancer cells in their body. The idea is to keep them dormant. So if you never had cancer, you want to put nutrients in that are going to keep them dormant. If you've had it, you want to make them dormant and then keep them dormant. That's the goal.
Thoughts on, you know, you hear a lot of conflicting things about both coffee. I've seen studies suggesting that it actually is, you know, it has antioxidants in it, or on the other hand, that, you know, caffeine is bad for you. And alcohol, particularly wine, because I've seen, you know, red and white wine pitched as being anti-cancer or as being awful things. What are your thoughts on this?
Well, again, moderation is the key here. Coffee contains caffeine, which contains caffeic acid, which is actually an anti-cancer substance. Most of the studies actually show coffee drinkers have a lower risk of many of the most common types of cancer. On the other hand, coffee is one of the most heavily sprayed crops in the world. So, you know, if you're going to be drinking coffee, try and include some organic coffee in there as well. Usually, if caffeine is going to bother you, you could have maybe 1 or 2 cups a day. You don't have to overdo it. I think tea is also a good choice. Tea has about 1/3 the caffeine of coffee. Black tea, white tea, green tea, all loaded with polyphenols. But I certainly don't tell my patients to avoid coffee. As far as alcohol, again, it's the amount that makes the difference. We know, especially with breast cancer, the drinking can promote breast cancer. My own feeling about it is because it's a very high caloric intake, requires a lot of insulin. It raises insulin-like growth factor. So if you're going to have like 4 ounces, especially if you've had cancer, of a glass of red wine within a 24-hour period, I wouldn't go over that. And I think for most people, they definitely shouldn't have more than 1 drink within a 24-hour period. But I think for most people, 1 is okay.
Interesting. What are the top, in your mind? You've gone through a variety of foods here and lifestyle things. What are the things beyond foods that people should do to prevent cancer or to deal with it once they have it? I'm thinking of things like exercise or where they choose to live or stress, or what are the other factors that are really significant or that there's a lot of mythology around? We have 1 minute left.
It's really hard science. So we know regular exercise, both weight-bearing and aerobic, is very positive for the immune system, especially the part that fights cancer. I tell everybody the foundation for good health, for recovering your health or keeping it, is to be peaceful inside. So stress reduction is key. I work with stress reduction with new patients, breathing exercises, guided imagery, music therapy. I've written a book on music therapy. It's very important adjunct. And I have to say, the vast majority of my patients over the last 25 years have told me that in retrospect, having had cancer was one of the best things that ever happened, because they really learned how to live each day. They learned how to have inner peace. They learned how to really start seeing more with their heart and not just to go into worry and fear about everything. That's a huge gift to get. So cancer can also be a very huge blessing if you look more deeply into it.
That's a remarkable reframe. Thank you so much, sir. Thank you very much, Dr. Gaynor.
Thank you.
To see this or other Conversations with Great Minds, go to our website at conversationswithgreatminds.com.